what the colour of the phlegm says about your patient.
White phlegm can be a sign of allergies, viral infection, or it can be normal.
Yellow phlegm from pneumonia or cystic fibrosis.
Charcoal grey can be environmental factors, heavy smokers, post-fire, or coal miners.
Brown phlegm from smokers, lung disease, old blood, bronchiectasis.
Pink frothy spit phlegm can be an indication of heart failure.
Green phlegm from a viral or bacterial infection.
Red phlegm can be a sign of cancer, PEs, or traumatic chest injuries.